why something would help, but then it would stop helping, or it would keep coming back. That's something that's in my brain since I graduated school, of why stuff keeps coming back. And then my journey over these 27 years has been trying to find that answer. And I've been able to explore and look at so many other different types of systems of the body. What I mean by that is not just going after the spinal system or the musculoskeletal system, but all the other ones, which I'm sure we'll talk about, because they all work together. And then I study many different disciplines. And one of the things I tell people is don't just look at the one thing that you do, because there's so many other things that could help. And you only have one lens to look at something. Everything looks like the lens that you're looking through. And it honestly never works like that. You can start through your lens, but realize that there's so much on the periphery or even behind you that you're not paying attention to. And then that lit my fire of exploration. Like I talk about movement. I just want you to explore movement. And it's the same with me for trying to look at how people, what their journey is towards getting the pain that they're in, but also really becoming a detective and figuring out why they're stuck there. I love that part.
Hey guys, it's Paula Nutting, your musculoskeletal specialist, although apparently I'm supposed to say therapist because you get in trouble if you say the word specialists here, with my very, very, very great friend, Perry Nickelsron. Dr. Perry Nickelsron is a chiropractor from the States, and I'm going to get you to do an intro because there's so much information on you, Perry. I just thought you could tell, where did you start from and how did you get into this arena?
Well, first of all, hi, Paula, and thank you, everyone, for having me out. I have to tell you, every time I'm with you, my energy already goes through the roof and improves. Because I remember the first time I saw your videos and your work, I was just drawn in because I'm like, this person has such a wonderful, authentic, genuine energy and feel. And the first thing I thought was, she loves what she's doing and really enjoys sharing that. So I just wanted to tell you that you made an impression with me before I even met you. And when we met in Australia, which was something that I'm never going to forget. So basically, I'm a big fanboy.
Thank you.
Yeah, so my journey, well, I've been in healthcare for about 27 years now, which is kind of crazy for me to say. And it's been a crazy journey. So my licensure, you might say, to do things to help people is under a chiropractic license. And I began that because I injured my lower back many, many years ago, bodybuilding and working out. And I just got into it because it helped me and I was drawn to it. Of course, most people, when you hear the word chiropractor, you kind of automatically think this is what they do, right? Low backs is kind of it, or spine, and you do adjustments, manipulations, or cracks that you might say. And I enjoyed it for a little while, but honestly, I was very kind of disheartened and disgruntled in a way because I felt there was always something a little bit deeper that I was missing. And I was very close to quitting the profession just because I was tired of only treating where people had pain.
Yeah.
And it would get better, or it would not get better. And then I just didn't want to say, well, it's going to take just a little bit more time. That wasn't a good enough answer, especially when you understand how the body works. Mm-hmm. But then I got really frustrated of why something would help, but then it would stop helping, or it would keep coming back. That's something that's in my brain since I graduated school, of why stuff keeps coming back. And then my journey over these 27 years has been trying to find that answer. And I've been able to explore and look at so many other different types of systems of the body. What I mean by that is not just going after the spinal system or the musculoskeletal system, but all the other ones, which I'm sure we'll talk about, because they all work together. And then I study many different disciplines. And one of the things I tell people is don't just look at the one thing that you do, because there's so many other things that could help. And you only have one lens to look at something. Everything looks like the lens that you're looking through. And it honestly never works like that. You can start through your lens, but realize that there's so much on the periphery or even behind you that you're not paying attention to. And then that lit my fire of exploration. Like I talk about movement. I just want you to explore movement. And it's the same with me for trying to look at how people, what their journey is towards getting the pain that they're in, but also really becoming a detective and figuring out why they're stuck there. I love that part. I love that part.
Yeah. It's becoming a detective and unpacking everything, isn't it?
Oh, yeah. You know what? I have a quote that I use all the time. Nothing is more terrifying than the idea of unlimited possibilities, because you're just like, there's so much here. I don't know where to start. And most of the time, your primal response when you have so many choices is to not do something. It's just don't do anything. Or just keep doing the one thing and hoping that everything else, I'll just worry about that later. And that's the human body. When somebody walks in to see you and they have a problem, it's scary to know that it can come from any damn thing it wants to. You have to start somewhere. So you start from your lens of training. And if it helps, then I tell people, how about you keep doing that? That's a good start. And if it doesn't help, how about you stop doing that and you look for something else? And if it helps, but it comes back, or it helps, but it stops helping, then you can keep doing what you're doing, but you have to look deeper. Or maybe you have to speak with your client and find out, a lot of times they're doing things that they don't know that they're doing, or you don't know that they're doing, that could be contributing to their issue, just because you don't know what you don't know. So it's both ways. So you don't have to be the one to fall on the sword because the person's not getting better. Most of the time it's because they're doing something they may not have told you, or in my experience, it's a question you didn't ask about something that's relevant.
Exactly. I know. So it's amazing, because quite often we as therapists don't have, we don't ask the right questions. We don't unpack what they've said, or we don't look at cues that they do. So we just kind of go, okay, that the longer we've been treating on this planet, the more we start going, oh, hang on, there's something that they say something, and then there might be a body language thing or something. You go, okay, we need to talk more about that. What happened on Tuesday? Or what do you do when you go bowling? Or what do you do when you, so you go shopping, but how many stairs are you taking? Oh, you got 42 bags of shopping and you're walking up 18 flights of stairs. So we need to ask the right questions.
Yeah, I love the word that you use there. It's unpacking, right? And I think that's a skill and an art form, the ability to nail down what we call consultation or history taking. I call it just human being communication, which means that you're actually actively listening, which is very hard for a lot of people to do, because most of the time, for every human, most of the time we're not even listening, we're just hearing, so we can respond with what we're already thinking we want to say. Right?
Yes.
So I'm not really hearing you, because it's all about me. But that can be a danger in healthcare too, because I mentioned it before. You have this lens and you're already starting to put together what might be going on from things, and sometimes you stop listening. And the one thing I've tried to devote myself towards is a huge amount of history intake before, almost to a point where you're like, okay, I mean, do I have to answer another question? Yeah, it is, because that really is going to divulge my answer, especially with chronic pain. There's something that I find, the one thing that I found over my years is that if people are struggling to get better, it's because there's a basic or a fundamental that was overlooked or glossed over, that some people think is irrelevant because it's so simple, or it happened so long ago, which is the thing that drives me bananas in modern medicine, is that if something happened a long time ago, it's really not clinically relevant to the particular model that we have right now, at least in the Western world, because we're looking for what happened yesterday or this week that may have caused that. And in my world, it can go all the way back to decades prior.
Yeah.
And then it just unlocks it. So, and the words you choose are really important. So when you actively listen to someone and you hear the words that they choose to communicate their story with you, that tells me their story.
Yeah.
Right? Because you realize how awful, first of all, that people talk about themselves without realizing that they're talking awful about themselves.
Yeah.
Words of, I can't, or there's a blame for their body or resentment, because when you're in pain for a long time, it's hard not to start to really hate on your own body, because you're like, why are you punishing me? Why are you doing this to me? Meanwhile, if you frame it and say, you know what, I mean, your body's just trying to show you lots of love. It's just loving you a little bit too much, because there can be such a thing as too much love as well. And when you reframe that, you can say, okay, what are you trying to tell me, body? I'm really going to listen. And that's why I always say pain for me. You can look at what the definition of pain, and you have all these pain science and neuroscience, and they'll give you a 500-word answer for what they think pain is. But to me, pain is very simple. Pain is a request for change. Pain is a request for change. The request is a very important word. And then change is a very important word, which means I just need you to do something different. That's all I'm trying to tell you. And I need you to figure out what that is. And pain creeps in, right? It comes in slow most of the time. We just choose to ignore it most of the time.
Yeah, that's exactly right. It's that noxious, slowly that cycle of going around. And it's 100%, because you talk about movement and in decades. And the first time that I saw your work was when we were kind of crossing paths through Victoria. You were teaching there, and I was on my way down to Tasmania for our last one of the conferences. And you were doing primal reflexes, or primal movement patterns.
Primal movement, yeah.
Yeah. Yeah, so that was really interesting, because I remember everyone crawling and doing all those patterns that if you miss them when you're little, you go straight from lying down to walking. We go from not understanding that cross patterning, that the brain misses out so much, doesn't it?
Yeah, well, once it goes back to basics and fundamentals, like I said before, right? So many times people may have skipped over them because everybody has a different developmental pattern for things. So I'm not saying that just because you didn't crawl that your world's going to fall apart. But what I'm going to say is that you may have a very important brain pattern that can help unlock what you're stuck in now. Or your nervous system never forgets anything. It always remembers it, even though you forget. That's my joke, is because we only think and remember what we can consciously remember, but your brain is always going by past experiences, whether you remember it or not. That's actually what drives your life more than conscious thought.
Yeah, your limbic system and your hypothalamus.
Yeah. So all I got to do is sometimes take your body back to where it hasn't been in a long period of time. And so take you back to rolling on the ground or crawling on the ground, and your brain goes, oh man, I remember this. You did this like 40 years ago. This was awesome when we were younger. And it'll go neuroplastic pretty fast. Yeah. And then it can be like a reboot for your nervous system, kind of like if my computer is stuck with the software. I'm just going to shut it down and activate it again. And it actually goes fast now. It works now. Because as you know, one of the metaphors we use all the time is that the human body is hardware and software. Yeah. And most people are busy going after the hardware part, which is the tissue, not realizing that the big driver is the software. And you always have to work both. The one way that you can help the software is by working on the hardware, of course. That's sensory input. But then it goes the other way too. Like if I can just reboot that switch. And I love it because I always say that people are blown away about how much better they feel when they do stuff on the ground that seems so simple. And I always do this analogy of like it's a dog. When you need to give your pet some medication and it doesn't want to take the medication, you just stick it in the dog treat. And all of a sudden, they take it and then they feel better, but they got the treat. And that's kind of what that is. I'm sneaking in some stuff when you do on the ground. And here's a novel idea. Once you get out of remember we talked about a little bit about kind of getting out of your own head, getting out of your own way before the podcast. began just humming or having fun. And this thing, when you get on the ground, you're going to feel ridiculous. And you're gonna say that I'm a grown adult. What am I doing on the ground? Or you might be in a gym environment and worried that somebody's gonna laugh at you because you're rolling or crawling. But when you begin to do it, right, you'll start to eventually smile and be moving and get into that flow state and notice some positive changes. And what I found in the pain world is a lot of times you get better when you just get out of your own way and you get out of your own head.
I agree completely. Getting out of it, and that's exactly right. That preconceived that this is going to hurt when I do this. And I don't know about you, but I'm like, for the therapists that are listening to this, I try to take history all the way through, not just at the start. But I don't shut up when they're on the table. It's not like, okay, we're going to be quiet so I can treat you for 45 minutes and then you get up and there's no change, because that's just inappropriate, unethical practice in my views. You should be asking questions all the time. And the movement stuff is, okay, so just let's just presume that everything's fine. I want you to pretend that you're 6. Was your shoulder sore when you were 6? No? Okay, so what are you wearing? Okay, so it's a pink dress with a white bow all right, so I want you to see yourself as that kid and take your arms through that range as that kid. Just see it. Okay, and I'll then take their hand at the wrist, if it's shoulder movement, and say, come on, we're going together. You and me, that 6-year-old girl, off we go together. And then I go, okay, you're on your own. And then it's just about trying to change at that limbic portion. Or get them to skip, like get up off the table. How do you feel? Okay, skip. No one, not skipping rope skip, because that's just god awful. But, skipping, because skipping is fun and it's joyful. And that, I think we need, like I say, humming, which is all vagal, skipping, which is enlightening. We're trying to stimulate the feel-good hormones. So therapists out there, that's what I believe that you need to be working. This is the biggest journey that we have to take in a lot of our clients.
That's such a beautiful thing you said there, Paula. It's so true. I mean, and some people call that guided imagery, right? Where you're using what's unique to the human species, imagination.
Yeah.
I think it was Einstein, kind of a smart cat, said imagination is more important than knowledge. And just in some of that, like if somebody was raising their arm up, right, and it's always hurt. Well, they're expecting it to hurt because it always hurt. It's almost like you're manifesting what you're expecting, kind of thing. And you can do distraction techniques where they're not thinking about what you're asking them to do, which is what I loved about there, because they're automatically, first of all, they're going cortical. So they're thinking, which is going to change the brain anyway when you use your thinking cortex. And then so they're thinking about that. They're not really thinking about the shoulder in and of itself. They are, but they're not.
Yeah.
They're thinking about the smells, the sounds, the dress, the time, and then all of a sudden it changes how they move. And we use that in the world all the time of a distraction technique. A classic example of you gotta little Johnny's got to go in for a vaccination, a needle, and he's freaking out because he hates needles and he expects it to hurt. And then all you got to do is show little Johnny the teddy bear in the corner. Hey, little Johnny is looking at the teddy bear, and meanwhile, bam, you get the shot. And he doesn't even feel the shot because he's not paying attention to the shot, even though the sensory input was, quote unquote, the same. You just got distracted. And I do that a lot in one of the contexts that I show people is I'll use an external instrument or an external cue that works quite well. So one of the things that I do, let's say that you have back pain, and if you bend to the side or bend forward, you expect your back to hurt. So a way that I can see, okay, is this a lot in your head, especially the more chronic it is, because you realize that back pain doesn't correlate to tissue damage whatsoever. Which means you can have a jacked up back on an MRI, but it doesn't mean it's going to hurt. And I'll just tell people, here's what I want you to do. I need you to keep your left foot or your right foot right where it is. You can move everything else. And then I have a long stick, right, that I'm going to use. And I'll just come at them very slowly with the stick. And I say, do whatever you got to do not to let me touch you with the stick.
Oh, wow.
And
That's very cool.
So what they're doing is they're concentrating on the stick, and they're going to go sideways. They're going to lean back. They're going to come forward. They're going to move everything. And they're just going to say, okay, don't move my left foot either. I can't move my left foot. And then I'll do that for like a minute, and then I'll come back, and then I'll ask them, I say, how's your back feel? And then they went in every kind of range of motion known to man, and they say, I didn't feel anything. Well, then we know that it's possible. And that in and of itself instills possibility, so that they know that they can explore that type of motion. So that's why I like external cueing a ton, and I mix it with the internal guided imagery, and I do both. But that's a real eye-opener for them of how the body changes based on where you direct your thoughts.
So any therapist who is listening to this could actually be applying that in their clinic. Like when you're doing assessment for them, just go, okay, but they could do exactly that. Or I think I saw you one time you did something with shoulder range. You had them lying down on the back with their hand on the wall, and then they had to kind of crawl, like they had to move their hand was adducted, and they were moving their body around so that they were actually, the hand came up to full elevation. It was
very similar.
Not moving the arm, but moving the body to provide the task.
Yeah, exactly. So with that one, I said, okay, if you're going to raise your arm up over your head, that's called shoulder flexion. So if you think about it, when your arm goes over your head, your body is below that shoulder, right? So the real motion is the arm coming up, and we call this relative motion. The lower body is below the shoulder this way, relative to the shoulder. So another way that I can get you there is that I'll have you stand in front of a wall and put your hand against the wall, and then you'll actually start to squat down.
Yeah.
And when you squat down, your arm will still be over your head and your body will still be below the shoulder, just like if I asked you to raise your arm, but you're getting there a completely different way. And then you're like, wow, it doesn't hurt when I do it that way. So we know it's just, you can do it. One, maybe you are saying, oh my God, if I raise my arm up, it's going to hurt. So you're already thinking that, right? Yep. But another reason that helps is because you get stability in the shoulder joint when you put your hand against the wall, and then you move your body around a stable joint. And one of the most important things I teach about helping shoulders is why you go down to the ground, because when you're on the ground, your shoulder is locked into the ground, and you move your body around the shoulder. That's actually how you learn to move the shoulder, is that you move your body around a fixed point on the shoulder. And so most of my shoulder rehab is actually based on the ground.
So we'll close chain exercise and using the joint that's most painful, or the least most functional in the current state, in the most stablest form. That's really cool. That's very cool. Yeah. So therapists, you could use that for hips. You could use that for shoulders. I guess you could use that for elbows or knees or anything really, if you kind of try to work
once you know that concept and you think about it. And I'll be honest with you, Paula, the more I do this stuff, the more I get away from structured corrective exercise.
Yeah.
Which means I'm trying to get, this is the exercise that's going to fix your shoulder or your back. And those are usually so driven by position and over cueing and overthinking. Okay, I need you to put your left arm at 15 degrees. I need you to tilt your pelvis backwards so it's flat. Breathe through your right nostril and rub your ear. And you're like, what? It's just like so many different things that the brain is like, how am I going to do this in real life? So what we do now is why I like that cueing of the stick or doing things is because it's more kind of natural movement that you'll get into during the day. And I make my movements more playful now, as opposed to what they call corrective driven.
Yeah.
And when you play, it automatically puts you in a state of safety. It's not quote unquote as serious. And that's the point. I've had people say, your work really doesn't look that serious or whatever. I'm like, you're completely missing the point of what I'm trying to do. Mm-hmm. That is the point.
Yeah.
Because when people are in pain and they go to rehab, they're scared. And they take pain so seriously and medicine so seriously, and it's do or die, and everything is so serious. And I've tried to get out of that and get a more playful environment, because you always have to remember there's a human being that you're ultimately treating, not the tissue that you're treating. And I read a great quote once that I use all the time when I teach. And it was this: there is zero correlation between appearing to be serious and actually being good at what you do.
Yeah. And it's not like fake it till you make it. In fact, the serious people are more fake it till they make it. But the other thing is those who can't teach. So, if you can't do it, then you teach it. And then it's like, okay, you're going to do it this way, because they haven't worked out the basic movements, actions, and then use this to go, how can I make, if Perry's got a shoulder pathology or got something with the neck, how can I make this work for him that it will be pain-free, it'll be smooth and easy, it will give support emotionally and set up a memory loop that's fun. And like Stephen Porges talks about, so we've got the vagal theory, like he talks about the mammalian and the reptilian, and currently our real super parasympathetic section is this eyes and face and hearing. That's the big thing now. It's like that connection. So that's our highest hierarchical change in the way we deal with stress. So what you're doing now is addressing that highest hierarchical mean, which is social connection.
Yeah, that's a huge part of it, right? I mean, that's what makes the community, the connection, and everybody wants that, right? And most people want to feel accepted, connected, loved, and you see it all the time. Is when you're alone, it's more stressful, because everybody needs some alone time, right? But it's more stressful, and that they've proven now they're doing the work with what they call neuropsychoimmunology, basically the nervous system, the immune system, and the psychological system, how they all work together. That community and support decreases stress, which decreases pain. And chronic pain and disease is linked to incessant stress. And, the more I do this work, there's two things I want to go back on. One is that people ask me, okay, doc, if I'm doing like a crawling pattern, should my pelvis be in anterior tilt or posterior tilt or neutral? And my answer is yes, which means I want you to be able to crawl in all of those positions, not just one. And you find I tell people, I want you to find the position that you feel most comfortable in first, whether it's clinically right or wrong, because there is no right or wrong to me. There's just different. So I'm going to put you where you want to move first, right? Then I'm going to take you into the other extremes of where you don't want to go. And I'm going to explore that parameter. Because in real life, trust me, when you go to pick up your grocery bag or pick up your kid or reflexively move when something's coming at you, your pelvis has to go wherever it wants to go, because you're not going to say, all right, there's a ball coming at me. I got a posterior pelvic tilt and engage my transverse abdominis and externally rotate my hip. It doesn't work like that. No. And what I like about Porges' work is that primal brain, that mammalian brain, the thinking brain versus the survival brain. When you look at movement, only 10% of the brain is devoted to voluntary movement. 10%. So that means I'm going to think about picking up, let's say I'm going to think about picking up a ball in front of me.
Yeah.
10% of that is voluntary conscious movement. The other 90% is reflexive, which means it happens without you having to think about it. So in my work, the key to restoration is not the voluntary part. No. It's the reflexive part. And guess what drives the reflexive part? Not the front, not the thinking brain, right? So we as humans, because we can think, we think we know it all. You don't know anything. Right? No. What's driving it is the one in the back that says, how about we don't die today? That'd be a really nice day for me.
The midbrain's got a lot to answer for just that. That's our motor, isn't it? just chugging
Yeah,
along back
so
there.
if I can check the survival box, your brain goes, okay, you're not dead today. That's a win. Everything else, I'm good with.
Yeah.
So, it's that hierarchy of needs that you go towards. So
Yeah.
when I understood that about looking at pain science, it also helped me figure out what's really going on with people is that I'm not really going to pay attention to what you're consciously moving. I'm going to look at it.
No, I agree.
But what I'm going to pay attention to is what has to reflexively stabilize for you to be able to move what you're moving. So when you move your left arm up over your head, it's not really your left arm that's the big driver. It's the opposite side of your body all the way down to the floor. That's the big driver, because that has to turn on to make sure you don't fall over.
Yeah.
Does that make sense?
100%, because that's when I teach the Chapman's reflexes, and I speak to the therapists who are practitioners now. I go, don't look at them like do your strength test, but look at what muscles are actually performing the strength. Because if we're doing adduction for the lats, and it's just supposed to be a nice clean movement here, and you're looking at the SCM on this side firing, and external rotation on the opposite leg, and the fingers doing falling back, they're the muscles that are actually trying to perform this task. So they might be strong as an ox in the move, but it's a false negative or false positive. It's not that they're still screwed. It's still ship patterning that needs to be fixed. So
yeah, I love that. That is such a great thing you pointed out, because that's about observation, right? Because most people would be, is this testing strong or weak? Do I have it done right? Which is technique. But then you look at everything else, because here's the thing, the person doesn't know that they're doing that.
yeah.
Hence the word reflexive.
Yeah.
So then you'll put together and you'll go, well, you know what? Maybe I've got a problem on my right shoulder because of that SCM on the left or the hip on the left. And to some people on the outside who don't understand how the body works as a whole, it seems insane. But it's actually not, because you're looking at the bigger picture of things. And that's usually where you find your driver. So it's that subconscious, non-conscious driven adaptation survival machine. And that's what stop chasing pain means. That's what my business means.
I was about to say exactly the same thing I was going to say. And for any therapist out there who's become proficient and good, they'll know that they've got to follow that you are Dr. Perry, stop chasing pain, stop chasing the thing that's, if they say I've got pain on my left hip, then look for why that left hip is being in stress. But it's not the left hip. The left hip is just hopping the shit because everything else is either, I always say, that's bad because everyone else is at the Bahamas drinking mojitos. They're all out there doing something. And this poor sucker is left at home to caretake. And he's just gone, I'm out, done. And I'm going to tell the brain to tell the mouth to tell everybody else I'm hurting. So, yeah. And that's why strength should be our work, as well as turn stuff on before you turn stuff off, for me.
Yeah, absolutely. Well, I mean, getting stronger fixes a lot of stuff in and of itself, right? I mean, that's a big component of overall health of the body, is a strength component. And so when it's stop chasing pain, you certainly treat pain. So if somebody comes on in and their hip is hurting, I'm going to treat there, partly because you expect me to, quite honestly. So I'm going to satisfy your need for me to do something to your hip. But then I know I'm going to look somewhere else, right? Especially when it's chronic. Here's how I look at it. If you come on and it's chronic, I pretty much know that's not where it is. Because most of the time, stuff would have worked to help you feel better, especially because there's a lot of really gifted therapists and programs out there that can help you. And I say to myself, I find out what everybody's done before they come in to see me, and I think, well, I'm not going to do that, because if that's what you needed, you wouldn't be standing here.
Yeah, I agree.
I'm going to expand my parameters of looking at a different place, assuming that you had a proper evaluation. And I got to make sure that, hey, I need to make sure you don't have a tumor in your hip, because you might. I mean, you need to go through your check boxes and your red flags. But there's also a difference between acute and chronic pain. I mean, if you slip and fall on your left hip and your hip hurts, well, I might want to look there.
Yeah.
But, you know, but then I'm going to ultimately ask my next question, why the hell did you trip in the first place? Because maybe you have a balance problem or a reflexive stabilization problem. So I'm going to have you fix your hip medical wise, and then you come see me after that. So if your leg's hanging off, you're not going to come see me for a lymph reset. You're going to put your leg back on, and then you better see me afterwards for some lymph resets, because it's going to be a mess in that system. I can tell you that much. And so that's where all of these places and all of these systems come together. And that was one of the biggest things in the beginning that really affected me, because I was very focused on pain sites in the beginning. And then one of my mentors that I studied with, his name is Gray Cook, he started to teach a principle of non-painful dysfunction, which means it doesn't hurt there, but it just doesn't function as well as it should for whatever reason that you see. And his novel idea was, how about you treat there too? And I thought that was like discovering the Ark of the Covenant. I was like, oh my God, that's like amazing. And I started to have some great results. But a few years later, I realized that I was still stuck in just looking at one system. I was still looking at the musculoskeletal system. And that's where my journey started to begin, more on looking at neurology, and then the lymph at the time through the Chapman points through exposure to you. And it wasn't until I just started to dig deeper and dig deeper and dig deeper and really begin to focus on all the other different systems and how they work together. So now when I see you move something, I'm going to look at musculoskeletal, but I'm also going to realize that there's a lot of other systems that I might have to check. And then your history will probably tell me what those might be.
Yeah. So tell the therapists that are listening and watching us about lymph reset. Because that's kind of your baby now, isn't it?
Yeah. Well, I got to give you props, because you were one of the very first people to expose me to the Chapman points, the neuro-lymphatic points. And I began to stimulate those and make some really, really big, great changes. And honestly, what I really loved about your work, and the more I studied pain science and neuroscience, the more it made sense to me, is that I see people teach those techniques, and they're very hard, they're very deep, they're very painful, and they've got fingers from Satan. They hurt.
Yeah.
And, and then I'm putting people in a lot of these pain states, and this sucks. Who the hell wants that? But I found out that the results didn't really last as long either. And then when I came you treated me when we met down in Australia, and I remember it was very, very light and gentle, and you were saying that you don't need to go really, really hard to get the benefits. And then that is pain science. You understand that a lot when you get deep in that rabbit hole. First of all, it felt great, because I think I fell asleep.
You did, but that's all right.
Because I was on a 24-hour flight from the U.S., and I was like, Paula, please don't take this personally, but that just felt good, first of all. But yeah, that you went light, and then that was the exposure to the nerve points and the lymphatic points. And it really, really helped me. But what happened later on for me, a couple of years later, is I just started to get an autoimmune condition where I began to get very sick overall. And they don't have a name for what happened to me. It just, my body started to turn on itself, and we don't know why, which is an unacceptable answer. So I was on a quest to determine that. And I got really, really sick and had to, pardon me, too much coffee. I began to get infections, and I get brain fatigue and tired, and I had to stop teaching and stop practicing because of the inflammation in my body. And it wasn't only through my own exploration, because medicine, in their attempts to help me, damn near killed me. Like, I don't think they were doing it on purpose. I'd like to think so. But it's just their paradigm or their lens. They only got one way to treat you, but it's with a hammer, surgeries and medications. But then I began to dig deeper into inflammation and swelling, because I was really swollen. And I said, you know what, there might be more to this lymph stuff than I thought. And I started to dig deeper into that system. And then now I do a lot of lymphatic work. And I realized, you know what, these points that I'm working to stimulate your lymph are the a lot of them are the neuro-lymphatic Chapman points. And I'm like, that's why it was helping so much, but mine just got so much deeper and so much manifested from my inflammation that I had to go and work more of the entire system for me, and then make some lifestyle changes and adaptations based on to some things that I was doing to my own body through nutrition or stress or thought. And that's one of the things I love about what you do, is because the neuro-lymphatic work is a big part of what you do, but you also teach a lot of other things to help people get that underlying stress response under control. Because if you don't get the stress response under control, the lymph is probably just going to keep returning back as a response to the stress. That's why I really like your approach there. That's what worked for me.
Yeah. So what, I'm just wondering if there's some, like, because I think I had a question with what was your biggest aha moment but that would be the biggest aha moment with your body that you needed to drastically change from one Western medicine to look at a different way to treat. And inflammatory system is we need to sort that out. Inflammation is the greatest cause of death on our planet, and stress is the underlying structure behind inflammation. So
yeah. So it's definitely mixing Eastern and Western medicine together, which I love to study both. So I try to tell everyone, Eastern and Western medicine are both speaking the same language. We're just using different words to describe what we're talking about.
Yeah. And we've traditionally minimalized, and they've always had large volume concepts. So
yeah, they look at the bigger picture. They look at the wholeness of the body and how everything interacts with each other. Western medicine is very reductionistic. They break things down to individual parts to try to understand it. But you forget that when you put all the parts together, they don't function the same when they're together as when they're separate. Yeah. And you can't separate them. They're not possible. That's what an ecological system does. Out in nature, it's an ecology where everything has to have a relationship with each other. And the whole system can have an effect if there's one component that might be the issue. And it's not always the most painful one. That's the thing I need people to understand. Just because it hurts doesn't mean that's the biggest problem that you have. And then I began to dig deeper as well. And I'm like, you know what? So the lymphatic system is an issue for sure. And, but there's a system in your body called your neuro-immune, right? Neuro-lymphatic, neuro-immune. So the nervous system and the immune system always work together.
Yeah.
You can't separate the two. So I was thinking to myself, you know what? The lymphatic system is one of the largest components, if not the largest component of your immune system. So my underlying issue was not so much musculoskeletal or neural driven at that point. It was immune system driven at that point. So that's when I started to go more after the underlying immune system, and then tying back to the stress, because when you get stress like that, you kick off an immune system response that happens. Yeah. And most people only think immune system when you're sick, not realizing that when you have an overactive immune system, it starts to break down the musculoskeletal system through inflammation. Then you'll get pain in your joints, pain in your muscles, pain in your ligaments and your fascia that are no longer musculoskeletal driven.
Yeah.
They're immune system driven. And then you realize that the two systems, I say this, I think I said it before, no system in your body ever works alone. They never get injured alone, and they never heal alone. So you have to look at how they relate to each other. And what drives me bananas in Western medicine is that everybody specializes in a system.
Yeah.
And when you specialize in one system, you stop looking at all the others, and your system is super special. But you don't look at how they relate to all of the others. And to me, a specialist is somebody who knows more and more about less and less. And you just go here and you forget this other part. So in Western medicine, I've got a gastroenterology guy that doesn't talk to my urologist, or I've got a cardiologist that doesn't talk to my urologist. And I'm like, you do realize that if your kidneys don't work well and drain well, you're going to have an issue with your heart, right? Or if your liver doesn't work well, you're going to have an issue with your heart, right? But they don't they don't go and talk to each other.
No.
And then that's one of the reasons why we're spiraling out of control, because we just see something that's isolated and we go, oh, that's got to be the problem. If it's in our way of thinking in medicine, we go, if it's low, I'm going to do something to make it high. If it's high, I'm going to do something to make it low. And one guess what the primary way they do that. They give you a pharmacological drug. And I'm like, dude, do you realize that there's balance in the body for a reason? If you just take something low and make it high, I can do that. But you better be asking why in the hell it went low in the first place. Because if I jam that high, then the back end is just going to go low. It's just the body's going to say, if you're increasing my yin, I'm going to take down your yang. And then vice versa. And then you get into this big cat and mouse game like this, and you become hooked on drugs, hooked on pain medications. And that's one of the biggest addictions we have in the world today, and kills a lot of people.
Yeah. I was over in the Seattle for the Massage Research Foundation, and they were doing big things over there with the amount of your returned war vets that kill themselves, like their PTSD and their pain. They're drugged up to the eyeballs on pain medications, and they're depressed and killing themselves. I mean, that's like, there's got to be a better way than giving drugs to people when you know that it's not working. Like, they're all addicted to opioids. These poor people.
And so I'm not saying that they might not be necessary, because I don't want any human being to suffer, right? And sometimes you have to take medication. For me, I had my thyroid gland removed 18 years ago because I had cancer. So they took that out. And interestingly enough, which I didn't know at the time, that might affect me later, they took out a majority of lymph nodes in my neck, which just might interfere with my ability to drain toxins from my brain or my whole body, because out of the 700, 800 lymph nodes in your body, 1/3 of that number is from the neck up. So they're sort of important. They're there for a reason. So I have to take what's called levothyroxine, which is a type of synthroid, because if I don't, I'm going to be dead within 4 days. So I got to take it, right? But then I know on the back end, I'm going to have to do a lot of other extra work because of that. But now in hindsight, now that I've learned more, I started asking myself, why in the hell did you get thyroid cancer, Perry? What's up with that? And now what I'm contending is that it probably was able to manifest itself because I was so toxic for so many years and didn't realize it. And, they can take out the tumor, which they should, right? But if you don't take care of the environment that the tumor grew in, it can manifest later as another tumor, or it can manifest itself as something else later. And I firmly believe, for me, 15 years later, it just decided to manifest itself as my autoimmune disease. It came out later because they took it out, but I didn't change anything of my habit. That's what frustrates me about medicine. I'm not bashing them, but just a paradigm I hate. If they find something on a scan, or they find something here, they say, oh, well, we'll monitor it for 6 months. And I'm like, okay, but what am I going to do differently in these 6 months? And we'll see what happens. Well, probably it's going to get worse because you're not changing anything that you're doing. And then all of a sudden, when it gets bad enough, or the pain gets bad enough, then that's when we're going to try to do something to help you at that standpoint. I would like to get it before you get to that standpoint, which is why we're struggling so much with chronic disease and autoimmune today more than ever before. We are really good at saving your life and putting damaged parts back together. Yeah. But I'm going to tell you, in my personal opinion, we are absolutely horrifically awful at putting the chronic pain and autoimmune puzzle together. We're going the complete opposite direction. So we have to change our lens. We have to change our thought process. But unfortunately, what I see, we're going in the other direction. Yeah, and I do tend to agree with what we see coming into hospitals and what we see coming into our clinics. Irritable bowel and chronic fatigue and fibromyalgia and all of the other little bits and pieces that are Lyme's, the things that are coming in. And you start looking at how is their gut health?
has anyone ever talked to them? If they were spoken to their doctor about their gut health, does the doctor have a clue about gut health? Yeah.
Probably not.
Yeah, so that's the sadness about it all.
So, and then when you do that, you realize that most of your lymphatics are in your gut.
Yeah, exactly. Funny, but yeah, I know. So I've taken like almost 50 minutes of your time and loved every second of it. But is there some couple of little things that you could show, like a couple of tips or tricks or something that you could, therapists out there that might say, like, I get someone who comes in with neck pain or headaches or something that you could go, yeah, if you do this Neuro-Immune reset, is there anything like that that's easy to show?
Yeah, so some of them they're probably going to be familiar with because of the things that you teach. A lot of these points are very, very similar, right? So it's like, hey, man, if it works, keep on doing it, right? Some of my work might be a little bit deeper than superficial work because I go after the organs a lot. The organs are what they call visceral work.
Well, I'd love to see.
If you do a lot of that.
No, yeah. I don't, but I'd love to see a couple of clever little visceral resets.
Yeah, I'll show you that. It's pretty simple, basic ones, because I find that a lot of people don't have a good motion of the organs themselves in relationship to each other, but also of the rest of the body. Because when you move your torso, for instance, and you rotate left and right, I mean, the organs need to kind of glide up underneath, like shear with each other. And they're stuck most of the time because there might be so much inflammation in the abdominal region that you're not aware of until somebody sticks their fingers there and you're like, wow, that really sucks. Because you know how much fun it is around the navel, right?
Yeah.
So I work there. But also one of the things that I tell people is just like you, when you teach good observation skills, just really begin to pay attention to the face in particular, because the face reveals, one, remember how you said the polyvagal about the smile, and just looking at the lines on the face, looking at the marks on the face, looking at the colors on the face. When you'll see, anytime you have an issue with lymphatics or organs, they will typically manifest somewhere on the body, but they'll manifest on the face a lot. So wherever I see issues on the face, that indicates I might want to start to go there. And the cheeks are a big one. So a lot of people will get like redness on the cheeks, a little puffiness in the cheeks, acne on the cheeks. And that is indicative of most of the time issues with the lungs themselves.
Okay.
The lungs and the large intestine. So I'll go to those particular places. And usually that means I've got to do a lot of work around the sternum or the lung area. Very, very toxic. Also, just a little side note that's kind of interesting. When people have a lot of redness around the cheeks, it's usually indicative of a low amount of stomach acid, hydrochloric acid. Oh, wow. So usually will increase the intake of stomach acid. You're checking, right? Which will help your body with the lymphatics anyway, because you're able to break down protein much more effectively. Then I usually tell people, try to take a little bit of hydrochloric acid or maybe a couple of caps of apple cider vinegar mixed into things and see how you feel. But I try to pay a lot of attention to the real estate from the top of the sternum down to the bottom of the navel. Because it's, in my experience, one of the most neglected areas of the human body because it rarely hurts on its own.
Okay, yeah. It doesn't hurt till you push it.
Yeah. Yeah. You hurt in your shoulders, you'll hurt in your hips or your neck, or usually you'll hurt in your spine somewhere. Yeah. The middle of the back, the lower back are pretty big ones. And so in our world, if it doesn't hurt, right, on a daily basis, or you have pain there, it's perfectly fine. Not so much, right? The two, I'll show you what it's called. Are people going to see this on video?
Yeah, this is going to be.
I'll stand up and I'll show you a couple of places that we check. Now, one of them I know that you teach is one of my favorites, is if you just assess right in the middle of the sternum in and of itself, between the two pectorals or the breast tissue. It is usually very tender, puffy, or swollen in this region, and it's not supposed to be. It's supposed to be hard, like the breastplate. And I stimulate that, and I look to see if it's tender, puffy, or swollen. And you know that that's the heart chakra that sits there. But also your thymus gland sits back there, which is part of your immune system, as well as holy cow, your heart sits there. It's the heart chakra. But that is also the area where the thoracic duct carrying the lymph from the lower part of the body separates off to go to the left side of the neck. So it gets puffy right there. So I rub that way. And then that's honestly one of the most powerful neurological points for your body. Then I'm going to go down to the bottom of the rib cage. So I'm going to stand up here so you guys can see me. And let me get my thing so I can see myself. Right, so I'm going to do this standing up. You can do this lying down. It's probably a little bit easier than standing up, but you know, you've got the bottom of the rib cages here. I call this your umbrella right here. And of course the diaphragm sits here. And when you breathe in, the diaphragm drops, which pushes your organs towards your pelvic floor.
Yeah.
Then when you exhale, all the organs and the diaphragm ricochets up. And then you have this pumping mechanism. And the pump is supposed to move fluid. That's what it's supposed to do right here. And you usually get so much tension underneath the ribs because people are slouched or they tilt and they're hunched over. And then it's just like taking my shirt and it becomes super tight. It's hard for me to raise my arm. It's hard for me to extend my hip. It's hard for me to rotate. It's hard for me to breathe. So it's a very simple one where you can just do a scooping motion. So you can use your hands or you can use, let me just get a little ball here really fast.
Sure.
So you can have someone do it to you or you can do it to yourself. So it's a scoop where you can either take your fingers or you can take a knife edge up underneath. And then all you're going to do is scoop down away from that rib cage towards the opposite hip or towards the navel. And if I'm on the left side now, I'm going to affect the tension around my spleen, my stomach, and my pancreas that gets stuck there. And I'll just do a scoop down towards the navel 4 times this way. And then I'll do the same thing on the right. And then now I'm going to get the liver and the gallbladder a lot. And then I'm just going to pull down up underneath. And I forget what reflex point sits under there. Is that the quad?
The quads,
Yeah. So, you know, that's going to make sense for me because if this is tight, I'm not going to be able to really use my quads quite well. Then I'll do the 4-corner scoop the other way like that. Or if I want, I can use a ball like this and the ball locks in there. And if I'm on the skin, it's even better because I can pull the skin a little bit. And you can see when I go, it'll pull the shoulder down a little bit. That way. So then I'm going to affect the ligaments of the liver and everything that's going to help my motion in my shoulder. I'm going to go there. And then the place that I like to spend some time after I do the scoop is I find the center of my navel. I find the bottom of the sternum or the top of the abdominal region. And I find the distance about halfway. That's usually the space that you're going to go. And then that right there, if you look at this, that's the center point of drawing an X from hip to shoulder. So that's the center point of drawing in. If you're not sure where it is, curl in and then write that. That's the spot. And it's also the center of rotation here. And I'm just going to stick my fingers in this region here, right? And then there's a couple different ways you can stimulate it. You can just come in and scoop up a little bit, nice and easy there to get that going. Or you can inhale through the nose and then you exhale through the mouth. And it's going to look like this. So I'm inhale, exhale, and as I exhale, I go like this.
Oh, like CPR.
Yeah, I'm doing CPR, but I'm doing it way down from your heart. And that's going to move the largest lymph node in the body called the cisterna chyli. So it'll get that pump going. It's also a highly emotional point, so many people will let loose and cry or exhibit many emotions from that region. So that's called the emotional center of the body. In Eastern medicine, it's called your chi point.
Yeah.
And if you can just do the scoop and then you do in there 4 times, it can make a massive difference on everyone. So those places, just the sternum, scoop, scoop here, I do
Yeah.
that on everyone for anything and everything. And your students will know just what points that those correspond with, which is sort of a lot.
Yeah. So that's really interesting. And you do that before you start, like you take history, etc. Then it's kind of like the set, like you set them up, or is it like?
Yeah, so I'll take my history for sure, and my history honestly is about an hour long. I mean, it's a long one. And then the first system of the body that I assess is the lymphatics. So what I do is I check all of the primary lymph node clusters of the body where they reside, and many of them will actually physically be the neurolymphatic points. So I'll assess the lymphatic points in a certain way. And here's the beautiful thing. The assessment actually is a lymphatic treatment at the same time.
Yeah.
Because of how I stimulate them is it how it releases pressure in the body. So people automatically notice a little bit of a change or improvement from that. But these areas, when you assess them like that, it's highly neurological. So you're getting a lot of sensory input into the brain. But there are areas of the body that get a lot of tension and tightness where you have restriction in blood flow as well and nerve flow.
Yeah.
Because what I want people to remember is that you and I know that even though we're just talking about the lymphatic system never runs by itself. So if I'm trying to think of my 3 fingers here, you know, I'm gonna have my lymphatic flow as one finger, my vascular flow as another,
Yes.
and then I'm gonna have nerve flow. So they all go together. And if you have a problem with one, you'll have a problem with all of them.
Yeah, that's right, because they're all interrelated.
Right, exactly. And then just when you stimulate these points that you're teaching, that's why it makes such a huge difference for people, because they're not just stimulating nerve points, neurolymphatic, I mean, that's what they call it, but a huge vascular component too, which is one of the things that I've discovered. You asked kind of in our pre-email messenger correspondence, like what's some of the stuff that I'm like really into right now. It's more of the vascularization and blood flow work.
That's really interesting.
I'm just learning different ways to manipulate blood flow, like I've done lymphatic flow. They're very similar, but there's a lot of different techniques that you can do that. So I think for me, the 2 systems in the body that I feel are the most neglected in healthcare and chronic disease, lymphatic by far.
Yeah.
It's not even close. But the other system that works directly with it, which is the vascular system of the body, because people don't even look at the vascular system as an issue unless you've got a blood clot or you got a heart issue. Other than that, they don't care about it. And I'm like, that's so not good.
Yeah.
And Eastern medicine does that. Eastern medicine concentrates on blood flow because for them, the chi flows through the blood.
Oh, well, okay. I know in Thai massage, they've got a flush point where they push down on your femoral artery and they hold it there for like 30 seconds or up to 2 minutes. I'm not sure. It's quite a ways. And then when they let it go, like we had it done when I was in Chiang Mai, and they let it go and you feel the flush of blood going down the leg and into the abdominal cavity. It's just the heat.
Yeah, I know.
Unbelievable.
So many of my techniques I've learned from that particular technique, but studying a lot in Taiwan and Thailand and Eastern types approaches. And, you know, it's almost like in the West, they'll call it blood flow restriction type therapy, but it's just learning how fluids move and where things have to go when they're blocked, and even understanding that about the lymph, right? If you've got stagnation or congestion in something, that pressure has to find a way to go somewhere, right? and you'll get backflow a lot, retroflow into things, and the same thing will happen for vascular flow. And when you can experience that, when somebody can say, okay, I'm going to stick my hand or my elbow or something on the artery coming out of your groin, and then I'm going to let go, you'll feel this massive rush of flow and energy that comes into the system. And it's extremely powerful. And it just so happens that that femoral artery sits right next to a huge cluster of lymph nodes in your groin. So,
yeah.
You know, they always,
funny how they work together.
Yeah, isn't it though? Yeah, and it's always flabbergasted me. Like, when I came across the lymphatic work, I mean, it just blew my mind, because I thought to myself, listen, I'm in this industry and nobody told me about this stuff. And I know that the average everyday person won't have an idea. But I thought to myself, how in the hell can any healthcare professional look at and read what I just saw and not run with it and realize that this is something that's really, really super critical? But they just kind of gloss over it as no big thing. I think it's starting to come around, honestly, because they're catching up. And I always joke around that, you remember the time where nobody gave two licks about fascia?
Yeah,
Nobody could care less about it. And the surgeons would just, let me just cut that through. That's in the way. I mean, there's no reason Mother Nature put it all there. I'm just going to cut through.
Yeah.
And then now you can't turn around without fascia,
yeah.
Right? I think the lymphatics will be the new fascia. I think that'll come around as being like the new thing.
And for me, I'm just thinking, like, it's such an interesting, this whole conversation, because my head's going, when we really first started, you look at the old textbooks and there was a skeleton, no muscles, nothing there, just the skeleton. And then, they said, well, this is ridiculous. The skeleton can't move without muscles. So then they started going, okay, well, let's look at the soft tissue. And then they overlaid it with, now we're talking about fascia, which is like 10 years ago plus. And now we're looking at fluid. So we're looking at not only lymph fluid, but vascular fluid. And I would say coming back to hyaluronic acid, which is like your fluidization of your fascia. Like, it'll be how quick fluid moves through the body that will make a change. So I think that's probably where we're heading.
I think so. And you just nailed it, right? So they're talking about fascia, but then they're saying how much fluid is actually involved with the fascia. And we forget that. The majority of our planet is water.
Yeah.
And you've got just a little bit of land. What is it, 70, 30%, something like that? Well, the human body is the same damn way.
Yeah.
It's mostly fluid, and then you got solid structure. So my whole approach changed, where I'm not going to keep going after the land masses anymore. Yeah. I'm going to go after the stuff that surrounds it, the fluid balance, the fluid dynamics.
That's interesting, because
it's really fascinating.
It is. And interesting that you said that, because I woke up, I set my alarm for 3:45 in the morning last week to listen to John Sharkey do a live webinar. And his thing is the same. He's talking about how we're made up more of water than of anything else. And then he's looking at the fluid and what's happening with the fluid and what's going to happen. And he was taking it right out to science matters. Like going in and looking at like supernovas exploding, and that's the only time that you really get ferrous, is when two planets will collide or two solar systems collide, and then you have all this iron, and the only thing that keeps us flowing and oxygenating our body is iron. So he turned this 1 hour or 1.5 hour webinar into this full circle, where he's gone from microscopically what's in the eye all the way out to planets, the solar system, and then back down to the human body. And it was really enlightening.
Yeah, well, I love that, because I think he's right. It's everything is connected, first of all, and it's all about energy, right? I mean, everything has this energetic connection, and energy never disappears; it just transfers itself somewhere else.
Yeah.
And I find that, you can't pick up anything in the world without being connected to something else. That's just energy wise. And that's kind of what I'm trying to do with the human body, where, you have to start with eye or whatever body part is an issue. You have to expand that out to a lot of other different things in your life. But even if you just think about the cellular environment of all these individual cells, because I don't know, you go about like 1 trillion or something, so there's more than one in there, and they have to live in a fluid-filled environment. And one of the things that I forget who said the quote, I can't get the name, but it stuck with me, and I say it all the time, is that you cannot get well in the same environment that you became ill within.
Yeah,
that's epigenetics, right? So it's your mental environment. That's probably the biggest one. It's your external environment, but it's also your internal environment. And then your internal environment is mostly fluid. So the cells have to surf in that fluid. And as long as, so I said to myself, if I can take care of the environment that's fluid and make sure that it moves well, then I should be able to have some type of impact on how the body feels. And I saw another great quote somewhere, I posted up, is that, well, if you're having a problem with the flower, you don't blame the flower. You go after the soil that it sits in. Yeah. And you got to figure out, well, maybe I got to do something with that. And maybe you should start watering it, first of all. That would be a good start.
Yeah,
right?
Get back to fluid. So,
yeah, you're back to fluid.
So I really want, I know you're running, which is really exciting, running courses online and live courses like Zoom kind of conceptual stuff, versus having to do face-to-face. You are doing face-to-face as well. But for people from Australia, if they want to desperately find a course that you're running versus waiting for you to come to Australia, because it might be a little bit of time yet in our current environment. What do they look at? Is it Stop Chasing Pain? Is that the best way to look for courses? And what are you running?
It is. Thank you very much for that, Paula. Yeah, you go to just type in Stop Chasing Pain, and you'll have a lot of stuff that shows up. I kind of been in the game for a long time, and that'll be the main hub, and it'll link to all of my social media accounts. The one I'm on the most is Instagram. I think I have an unhealthy relationship with Instagram. We're very close, but
you do some great stuff on Instagram. Yeah, and if people want to find Perry, like look him up, look up Stop Chasing Pain. I think more than Perry, but
yeah. Stop Chasing Pain is kind of the thing. But if you type in my name, it'll show up too. We're kind of interconnected.
And what you'll do is you'll find that there's quite a few times he's actually doing live, like he'll talk and put it on live kind of feed at the same time. So if you kind of become an unhealthy relationship with Stop Chasing Pain in Instagram, you might actually have a chance to talk and ask Perry some questions at the same time. So
yeah, you can do that. I always get back to anybody who reaches out to me on Instagram. I take care of the account myself, and any live episodes are recorded, and there's a section on Instagram, if you don't know about it, called Instagram TV, and the videos are longer than you can do on your typical 1-minute ones. You can go there and check that out. You can click a follow, and then the hyperlink at the top and the Instagram profile will take you to a thing where you can link to anything you want, from a workshop to a webinar. And I put it so there's many different ways that if people want to learn from me, they can take an individual short webinar that they can watch. And I've also got an online membership site, kind of like what you've got, that they can go there and sign up for monthly or yearly or whatever. And then I've got the webcast for now until the world settles down. Who knows if it will, that you can go on and do that. So there's many different options that you can go through to learn from there. Yeah.
And guys, all I can say is that the amount of knowledge and the dissemination of the knowledge, because you can find some people who have got incredibly great knowledge and are absolute crap at presenting, where Perry has got it in spades. He teaches in a way that people really understand, they get it, it's fun, it's nurturing, and it's really experiential, so you get a lot out of it. So All I can say is, after you've listened to this, you want to click on you want to tell 3 friends to become a member of my site, and then you want to get all 4 of you to jump over and actually get hold of Perry's site and click on some of his stuff, because it's unreal.
Oh, thank you very much, Paula, and ditto right back at you. Much love, always.
Yeah. So I'm going to sign us out. It's like we've gone for way over the normal time, but I knew that was going to happen anyway.
Fun times.
Yeah, stop chasing pain is where you want to go. Your musculoskeletal specialist is me, and it's the Supercharged Therapist portal that I want you guys to get on board with. So thanks again.
Hey guys, thanks for sticking around to the end of the video. I really appreciate it. What you could do is you could hit the subscribe button if you haven't already. When you're ready to take the next step, why don't you click the link below and get into more information about my mentorship program, and I'll see you on the other side.